the breast cancer. So you're seeing a little bit more in the population in the Asia people. So those cancer is preventive if we can know how to find out the sign and symptom, detect it, and do the early detection. It is help us to improve our health and get cure. So we talk about what is breast cancer. So breast cancer mainly is a lot of angles. So I just elaborated. Mainly it's just a breast cancer cell, and it grow. The cancer cells grow out of the control. And first it started with a small lump, and sometimes you feel it, sometimes don't. And the tumor, and it can grow. And when you say cancer, you usually call malignant. And sometimes if the tumor is not in the shape and go outside of the tissue, and then we call it metastasis. So the breast cancer is mainly in the women's population. So, but also can happen to men, and statistically about 1% is of the men. And I believe in my 30 years oncology, I see maybe like a 3 to 4 patient is a man, is had a breast cancer. So, but the rest of them is all women. So we probably have most time people will ask is how this started. We at this point that we do not know what is the cause, but we just doing a lot of research study trying to see how to make it started, and still want to find out what the cause. But now we just they doing some study just link on this population have more people more chance to get the breast cancer. So it started mainly for the gene is like the gene, like the DNA, and for the cancer cell, and some of them is passed on by parent, and some is acquired later on their life, that's more related to the lifestyle related. So a little bit later we talk about a little bit more detail. So basically the cell, the cancer cells from the breast is a change. So this is just a general, this is a normal tissue. The only thing pay attention is just related to the lobular and the duct, and then the big chain, all this is related to the lymph nodes. And when the cancer spread it, and that we're talking about lymph node dissection, and those is the lymph nodes. Now, how common is the breast cancer? We mainly talking about United States. The breast cancer mostly is for women, except the skin cancer. That's what statistic. Now, average risk of the women have breast cancer. The average risk is, you're talking about the lifetime, doing about 12%, and it's the average risk. So that means 1 out of the 8 will have a chance, like you and me could have a chance to get it. It's out of the 8, that is the average risk. So they predicted in the year in 2018, it's about 266 plus thousand will be half an invasive breast cancer in this year. Now the good news is the death rate for the breast cancer is dropped to 39% from 89 to 2015. So the reason is that's what we're trying to do to make people aware that can be prevented for some way, reduce the risk to prevent, but not complete prevent. So because the more women are aware and how to do the mammogram to get the early find out and also improvement of the medical treatment for the breast cancer. The American Cancer Society suggests, and this is the guideline for people. So if age 44, 40 to in this age, and then you can start it for the mammogram. Usually the insurance is supposed to pay for that. It's supposed to wellness checkup. So if the age is 45 to 54, it suggests a mammogram every year. And if the age is 55 and older, and you can do every year or every 2, and continue to get the screen. So that's the guideline. Now, for mammogram, I think most of people are probably in, maybe you somehow you have a chance to do it, but it's more like an X-ray. It's not invasive, and you make appointment and you go, and the test is a little bit discomfort. It's more compressed on the breast and take the X-ray. So sometimes it's not always detected the lump, but it's a higher. It's a recommendation. You still can do the early detection in many cases. And the South breast exam, that's we're going to go over a little bit more detail. We're going to go over and let teach you, or if you didn't know, and how to do your exam for your breast and how to look at that and see, find out if there's any problem. And before, and they also call clinical breast exam if someone goes to the GYN doctor checkup, and the doctor or professional, health professional check on that. That's the clinical breast exam. And so we just trying to advocate, tell people that we should look at ourselves each day, monthly, and just and we always know. We're probably the first one to find out whether we have anything change in our breast and any health condition. So that we can go over a little bit more for that. So now, if you find out there is some lump, you find something, and of course you go to see, talk to your the doctor. And if they need to do some workup, and also involved with the breast ultrasound, and usually it's not invasive in the ultrasound to checking, see this is the mass. Ultrasound is have a better tell that it's a mass, is a solid, or is it just a cyst. Is a cyst is just a liquid. So sometimes they aspirate it and do the biopsy, test it, it's not cancer, so you feel it's safe. So that's the one. And breast MRI scan is a little bit more detail about, the MRI can check in much more in detail, and also can sizing the mass. But usually, pretty much to confirm the person had the mass, and then the doctor would suggest an MRI, and then a measurement. Also, MRI can get almost slices and help the doctor to see it, and also can sometimes guide them to the wire biopsy too. So biopsy is an invasive procedure, and usually the doctor will do it and get the specimen and pathology, and to see whether it's a cancer or just a lump. This is the South breast exam, and we can go over, and we also outside will put some pamphlet, you can take it home, and just a little reminder you can tell your friend and a lady friend or man, and to do the self-exam. We probably all like to know what is, how do we look, and so if this is the symptom, and if for the breast cancer, and if you see some like a lump and mass, or sometimes no pain, sometimes the heart, sometimes it is sore, and they are more like an irregular shape. If you feel that, and also, and when you touch it, you get a little bit uncomfortable, and those is the early sign. So sometimes can be more advanced. Those is like obviously if you see a little bit swelling all around and the breast, and you feel painful, and the skin of the breast look like an orange skin, that's called dimpling. And then the nipple also painful, and also has some discharge come out, and you feel some lump in the collarbone, and all this is abnormal, and should be seen the doctor right away. So you don't once in our practice. That is a few times we see the patient came in here, the breast, it look like cauliflower. 那个椰菜花. Because why the patient don't come to see doctor? Because those patients, can you believe what they say? They said they believe God can heal them. But what I tell them is, I said God created people to learn about the medicine. And the medicine is because God created doctor. The doctor is to help you to take care of your health. So, but we do have a couple cases coming here, patient, and really look like cauliflower, 就椰菜花. It's all the tissues are rotten, but of course we don't want to wait for that moment to happen. So it's not much they can do, the doctor can do. So this is the risk that we're talking about, the risk factor. Like we're talking about the breast cancer, we don't know the cause, but we trying to talk about also for the risk, and trying to lower down the risk to prevent to have breast cancer. So the risk is not able to change is the women in population, and also the older age, and that we can change and have a higher chance to get breast cancer. And if we inherit the gene, 是遗传, and then carry on the gene is a higher risk, and the family, the sibling is a higher risk. Race. Usually they talk about for American wise, the white population is more breast cancer than the African American. But if breast cancer in the younger age, 45, usually the African American is a little bit more, and for the Asian, Native American, and relatively lower for breast cancer. So the risk factor you can change is regarding, so like alcohol drinking, so recommendations of 1 drink a day. And I know a lot of Asian people may not do too much for daily drinking, but for American, for other race, I saw people like drinking quite a lot. So recommendation should not be more than 1 drink a day. On overweight, not too much here, but it's still overweight is a part of the risk, because when the weight is overweight, a lot of fat tissue, the fat tissue can produce more estrogen. The estrogen is increased, and also insulin level also increased, and that it gives a higher chance to get breast cancer. And also, not having children by age 30 usually also considered high risk. This is all related to the hormone change, and also people, the mother not have a breastfeeding, so that also one of the risks. So taking birth control and hormone therapy, and this is all related to the hormone can change the body and the chemistry and give a high risk, and breast implant and also cause of lymphoma. I know most of the Asia patient come in here in the hospital. Most of them they don't do much breast reconstruction and implant. A lot of the time they just say they're not too much concerned, just to cut it and get it over. So that's how Asian people say. But for other population, American or other, they very conscious about how they look, so they want to do the reconstruction. In the old day, we do a lot of implants, silicone, but the problem is they always come back with a complication, infection, and they end up is taking hospital stay, antibiotic, and finally had to remove. Every time you infect, they had to remove. So I don't see a lot of good thing about that except the temporary look. But now, later on, when I talk about surgery, I tell you a little bit more of the new trend. This is the woman high risk. Basically, is the people high risk. We suggest that they have a MRI breast, MRI and mammogram every year, and start from the age of 30. So this is the one for when they have a high risk. What it means is the lifetime, they have a 20 to 25% chance to get the breast cancer. And also the gene, have testing the BRCA gene mutation. So they do the genetic study, had the gene, they have the gene mutation, those is a high risk. And also their first sibling, the first degree relative, like a sibling and parent, have the gene mutation. Those are also considered high risk. And so if the people have a radiation therapy, age 10 on the chest, 10, between the age of 10 and 30, that means early young age, they also have a chance to get the high risk. Now, the cancer, mainly breast cancer, the mainly is carcinoma. That is for the breast cancer. Most of them is on the dot and the purple one, the dot and the lobule. So that's the main spot in the breast cancer. And the treatment is, most of them, this is general. The treatment usually surgery. The surgery is, in the old day, we do a lot of radical mastectomy. It's pretty much cut everything. Radical is become flat, like in the past. So because they want to conserve the breast and help the woman feel better, looks better, and feel more balanced. So now we do more is conservative. So they do the take out the tumor, but try to minimize and not cutting as much as they can. But they do believe from the study, they said the outcome is about the same. You don't have to cut completely. Every single thing become flat. You still can cut remove the cancer. So and then the surgery in this time we do a lot. These are reconstructed. In the past you implant, but now they take a lot of the abdominal deep muscle. We call the deep flat. So take out the muscle from the deep, and a lot of women like this because they one point they trim, right? It looks good. Your belly become flat. At the same time, they take out the deep muscle from that and put it in here. So usually we take like a 10 hour, this kind of surgery. First they did the surgery, and then plastic surgeon go in, takes about 8 to 10 hours to take the muscle, and they had to put it in the breast. So it takes about, they need to stay in the hospital like at least 4 days. And what they go through is pretty tough after the surgery. But they do look good, and so that's the reason in the trend of this day.